Why are decontamination standards critical in plastic surgery? Imagine going in for a cosmetic procedure and trusting that every tool used has been thoroughly cleaned and sterilized. That trust is built on strict decontamination standards, which are essential in plastic surgery. These standards ensure that all surgical instruments and environments are free of harmful microorganisms like bacteria, viruses, and fungi. Without proper sterilization, these pathogens can be introduced into the patient's body, leading to infections that can cause complications, slow healing, or even more serious health issues. In plastic surgery, many procedures involve making incisions or placing implants, which expose sterile tissue to potential contamination. If instruments are not properly decontaminated, microbes can survive and cause surgical site infections. These infections can ruin the results of the surgery, cause pain, or requiring additional treatments. That's why following strict sterilization protocols is so important for patient safety and successful outcomes. One key reason for these standards is to prevent infections. Instruments must be thoroughly cleaned to remove blood, tissue, and other debris before sterilization. This process reduces the risk of infection, which can compromise both cosmetic and reconstructive results. International guidelines from organizations like the World Health Organization and the Centers for Disease Control and Prevention recommend multi-step procedures. These include cleaning, disinfection, and sterilization, often using autoclaves, which use high-pressure steam to kill all microbes. Proper decontamination also helps preserve the instruments themselves. Careful handling, cleaning, and inspection prevent damage or corrosion that could impair their function. For example, using sterile water instead of saline during cleaning helps prevent rusting. Disassembling complex instruments ensures all surfaces are properly cleaned and sterilized, which is vital for their longevity and safety. Protecting healthcare staff is another important aspect. Decontamination protocols include the use of personal protective equipment like gloves and masks to shield staff from exposure to infectious materials. This reduces occupational risks and keeps everyone safe during the cleaning process. Traceability is also critical. Keeping records of sterilization cycles, using biological and chemical indicators, and monitoring sterilization equipment help ensure that instruments are properly sterilized every time. This documentation is vital for quality control and for addressing any issues that might arise, such as infections linked to contaminated instruments. Ethically, medical professionals have a duty to do no harm. Following decontamination standards is part of providing safe, responsible care. It also helps clinics and surgeons avoid legal issues related to infection transmission, which can have serious consequences. In resource-limited settings, sterilization might not always be through autoclaving. Validated methods like pressure cooking, boiling, or chemical immersion can be used if they meet high-level disinfection or sterilization standards. The key is that these methods must be proven effective. In practice, decontamination involves several steps. First, removing visible soil from instruments. Then manually cleaning and disassembling tools to reach all surfaces. Next, inspecting each instrument for damage. Following that, sterilizing using autoclaves or other validated methods. After sterilization, instruments are dried, packaged, and stored in sterile conditions until used. Proper staff training and strict protocols ensure these steps are consistently followed. In conclusion, decontamination standards are vital in plastic surgery because they protect patients from infections, ensure instruments work properly, safeguard healthcare workers, and uphold ethical and legal responsibilities. Without rigorous adherence to these protocols, the risk of complications rises, which can compromise both health and the success of the procedure. Always remember to consult qualified medical professionals for personalized advice and to follow established safety guidelines to keep everyone safe.